Thank you, everyone, for joining us today for this session on Access Medicine and Access APN for NP Education and beyond. My name is Kaylin Creason. I am with the Customer Success team at McGraw-Hill. I'm a librarian, and it's my job to make your lives easier, at least when it comes to Access Medicine and Access APN. But I'm not the only one who's here to help you see the sites and all that they can do for you. I have some excellent experts with me here as well. Before I introduce them, just a little bit of housekeeping before we get started info. You're all automatically muted. I mentioned that a minute ago, but don't worry, I can't see and hear you. You are all good. That being said, if you have questions, which we encourage, please use the chat or the Q&A, and I will get those questions and field them to our excellent experts today. This webinar is being recorded. You will receive a link to the recording within the next few days. So if you do have to step out or leave early for any reason, just note that you will get a link to that recording. Finally, if you have tech issues at any point, feel free to chat with me as the host or me individually, or send an email to my McGraw-Hill email. You can also write down that email if you like and ask me any questions after our session today. But at the end, not only will we have time for questions at the end of the session, but I'll also list some other contact information as well. All right, and with that, I am going to introduce our wonderful experts on the call today, and they will get started telling you all about these great sites and what they have to offer for you. So first things first, our first speaker today is Sydney Keene Vitale. She is the editor of AccessAPN and all advanced practice nursing content at McGraw-Hill. In addition to APN content, Sydney's also the editor for surgical content and other allied health fields as well. Next, we have Julie Grishaw, ACNP. Julie is the managing editor of Access Medicine. She's also a full-time practicing acute care nurse practitioner and has been practicing in critical care as an ACNP since 2010. Julie's passionate about combining her clinical expertise and editorial experience to help librarians, faculty, and learners as they navigate through Access Medicine. This isn't in her bio, but I'm going to add that Julie's feeling a little under the weather today. So if we chime in for her, trust us that we're just trying to help out. And she's so committed to being here that even with her little froggy voice, she's going to introduce you to all the great stuff on Access Medicine for you. Okay, that was my shout out to you, Julie. Sorry. All
Don't
right,
always sound
last
like
and
a frog.
what'd you
I,
say?
I don't always sound like a frog.
You don't. That was really good. That was so great, you poor thing. Um, no, she does not always sound like a frog. All right. Last and not at all least is Melanie Allison, DNP, MSN, RN, ACNP-BC. And Melanie is the Director of Education and Learning with McGraw-Hill Professional Medical Division. Melanie earned her Doctor of Nursing Practice degree and Postmaster's Certificate in Nursing Education from the Johns Hopkins University. Oops. She earned her Master of Science in Nursing degree, specializing as an acute care nurse practitioner from Vanderbilt University. And finally, Melanie has more than 20 years of experience as a registered nurse and nurse practitioner in adult cardiology and advanced lipid management. She's an adjunct faculty member at Vanderbilt University, where she's taught for more than 18 years. So all of that to say, you are in very good hands today with our site demo with our various editors, practicing clinicians, and experts, directors. So I will turn it over to them. All right, and I believe Sydney, you're first. So if you want to share your screen and go through Access APN, that would be wonderful. All right.
That sounds great. Okay, let me get my screen set up. It says that the host disabled participant screen sharing.
That's not true, but it might be true. I believe you. So let me fix it. All right, how's that for you?
Okay, here we go. So you shall see my screen here. And this is the homepage of AccessAPN. AccessAPN is our fairly new platform for advanced practice nurses in partnership with Sigma Theta Tau, the Honor Society for Nursing. The site launched about a year and a half ago, and is a dynamic resource that is a bolt-on product to our large clinical resource, AccessMedicine. What that means is it is an additional plugin to AccessMedicine that serves the APN market specifically with all of that important non-clinical content. We're well aware that the clinical needs for advanced practice nursing education and practice is fulfilled by AccessMedicine. All of the clinical content that you're going to look for in your education and in your instruction is going to be found on AccessMedicine. AccessAPN serves as a resource to supplement that with non-clinical content, as well as some fun digital resources and interactive resources on clinical topics that are especially pertinent to advanced practice nurses in those larger areas that we see representation. So here on the homepage, we see this ticker of some of our top books on the site. And when we toggle over to the Books tab, you will find different categories of books and a full library of titles, both from Sigma Theta Tau and McGraw Hill. And so you can kind of scroll through the different categories that we've created here to find books within those categories. And these are ebooks. So this portion of the site is sort of like an ebook library for all of those titles applicable to advanced practice nurses, while the rest of the site is everything more dynamic and interactive and digital first. So for example, when we go into the quick reference tab, we have one of our most exciting features of the site that's very new. These are visual abstracts done by Dr. Mike Nader, who is an endocrinologist at NYU Langone. Dr. Nader has a really strong social media following. He is TikTok famous, Instagram famous with over 100,000 followers. And his background is really interesting. He was diagnosed with type 1 diabetes when he was a child. And throughout his education, he actually focused on the visual arts. So through high school and college, he had a really significant educational focus on the arts. And in conjunction with his interest in the arts, he had a strong interest in medicine because of his experience as a type 1 diabetic from a young age. And during his undergraduate and medical school career, he himself used art to help him study and to help him prepare for exams all the way up to his high stakes board review exams. And so when he kind of graduated, he felt that the learning style of really visual content was not so heavily represented in the way that he was experiencing it for himself. So he launched his own brand, and in partnership with AccessAPN, he looked through our site, he talks to different contributors that we have, and he fields suggestions from our audience, students and faculty, to pick areas of medicine that are really applicable to the APN market. And he creates these visual abstracts that kind of break down complex topics in a way that visual learners can absorb. They are printable, downloadable PDFs, so students can annotate them themselves and kind of make them their own. And in conjunction with each visual abstract, which comes out quarterly, as the name kind of reveals, he also makes these kind of TikTok style videos for each one, walking through his artistic development of each visual abstract while talking through the concept and breaking it down into a way that's easily understandable, yes, for visual learners, but also auditory learners, because he just has such an appreciation for those different learning styles. So Dr. Nader submits a visual abstract and a video quarterly, and we have them up on the site. And we're always happy to field suggestions for topics for Dr. Nader to cover in the future. Crowdsourcing information for content on the site is something I'm very passionate about as editor. This is a new market for McGraw Hill. And so having a listening ear to faculty, instructors, stakeholders at these institutions and programs, as well as students, is really critical for making a successful product. And it's something that you'll kind of see represented across different content features that we have, because a lot of the content creators are actually attendees of this webinar. I saw your names. So we definitely are really interested in partnering with faculty and educators from across the country at different programs. So if you're interested in contributing to AccessAPN or the APN offerings through McGraw-Hill, please reach out. So in addition to the Nader quarterly videos, we have these other videos from a company called MedCram. These are licensed videos. MedCram is a company run by two MDs who create these videos in a sort of Khan Academy style. So if you're familiar with, I used them to learn calculus in college and high school. But these videos are specifically on ECG and EKG, but we have around 70 more videos coming after the success of these videos on the site in other areas of medicine pertinent to the APN audience in a couple of months. And I'm going to play this without sound while I'm talking. I hope it works. But you'll be able to see kind of how these videos are structured. And this is the style of the videos across the ECG videos and then the other videos that will be coming to the site soon. Very visual, but there is transcript on the side. It can be read out to you if that helps with your learning or if it's an accessibility need. But while the video kind of goes through the different visual representations of the topic at hand, there are also, skip to this part, drawings being done in real time on the screen in front of you. So you're able to kind of see the process of the explanation as it's happening. So another way for students and faculty to further engage with complex topics. Okay. So another feature on the site that is kind of growing in the next couple of months are our case offerings. So from the book tab, you'll see representation of 4 different books here. And incidentally, these 4 books are some of our top sellers and top used book content on AccessAPN for the APN market. It is both AACN Essentials books, 1 critical care, 1 progressive care, and then 2 pharmacotherapy books. Both AACN Essentials books are coming out in 5th editions in just a couple of weeks. So this will be updated on the site with 2 brand new editions and all new cases. But these are, again, a way to interact with the material in a different and dynamic way that is kind of beyond just a flat book or flat ebook. So each case is represented here, and then you can have the option of clicking down here or toggling over here to the questions that are associated with each case. So in addition to these 4 cases, the case categories that are associated with books in the ebook library, we just signed a contract to have monthly cases on the homepage. Again, that's a new case every month, specifically in psych mental health from a psych mental health program director from Mississippi. And that is another manifestation of a direct response to customer and faculty feedback about the site. At a few conferences that I had the pleasure and privilege of attending over the past couple of months in Orlando, non-PF, and then in New Orleans. The feedback that I got from various faculty members, some of you may be watching this webinar, was that there was an immense need for psych mental health content. There's a pretty unprecedented growth in psych mental health programs countrywide, and that looks like exponentially higher enrollment in existing programs and new programs being started because there is such a need for psych mental health advanced practice nurses. And so in an effort to get timely and topical coverage of psych mental health issues. We've enlisted an expert in the field to author a monthly case on a psych mental health issue with accompanying questions for review right on the homepage every month. So those will be collected on the site and kind of archived as well. So you'll have access to the library of those cases as they amass. But kind of interesting and dynamic way to engage with content that, yes, is applicable to those in psych mental health programs specifically, but also is really important for APNs across specialties because, for example, I believe it's 75% of APNs are in family medicine. The reality of family medicine practitioner is that you will be confronted with psych mental health presentations in patients. It's a kind of triage situation in a lot of cases, and referrals will be made, but to be able to engage with this kind of content, even when you're not in a program dedicated to it, is feedback that we got from faculty. That's something that would be really helpful. So we're really excited to have that on the site, and it'll be live and active in a couple of months. And we're just thrilled to have that, really dynamic content. The benefit to having content like that written on a monthly basis is that really topical and timely issues can be covered with a relatively short turnaround. So something that maybe practitioners and students are addressing due to something happening in kind of a real life setting can be addressed rather than waiting for the publication of a whole book, which can take years in reality. So beyond cases, we also have this library of review question categories. So most of these are associated with accompanying books. You'll notice pharmacotherapy, 2 books here. They also have cases. They have Q&A here collected. But there are also a few resources here that are not associated with books and are just test banks in areas that are especially pertinent to the APN audience. So we have certification review for nurse anesthesia, and then our fairly new, as in just a couple of months since publication, family medicine and adult gerontology review for advanced practice nurses. Again, this is an example of user and faculty feedback made real on AccessAPN. Family medicine and adult gerontology are 2 of the areas that advanced practice nurses are the most kind of prevalent in percentage-wise and education-wise. So we wanted to amass questions written by experts in their fields to author questions to help students engage with family medicine and adult gerontology content in another way. We're really aiming to serve all learning styles and really aiming to have a wide array of content types on this site and continue to add value to it and enrich your experience as faculty and the students' experience as users of the site. So on here, you can start a random quiz, or you can make a custom quiz by putting in a number of questions and then starting that custom quiz. So for example, if you know that you have are struggling more with adult gerontology questions, you can decide to do more of those questions in a test. You can choose the breakdown, or you can do a random quiz, put any number in here under the 600, which is the total number of questions, and have a kind of new collection of quizzes each time. Every time you go in to start a random quiz, different questions will populate. So you're able to bite off what you can do at that time based on the time you can dedicate to studying when you sit down to do this. The thing that is very new to the site that we're really excited about, that is especially pertinent to the audience of this webinar, is the For Instructors tab. So this is, I believe I logged in, I did. So to access this portion of the site, you need to have an instructor login. So when your institution subscribes to AccessAPN, only faculty instructors are given access to this page. If you do not have an instructor profile and you have the default student profile, which is what all your students will have, they can get to this page. And then when they go to click on anything here, there is a firewall there. They're told that they need instructor privileges to get there. And what that does is a lot of this content is extremely applicable to students, but it kind of puts it in your tool belt as instructors first. Some more of that feedback that we got from faculty at the conferences that we attended and in conversations that I've had before and since then is that one of the biggest challenges that faculty are facing is engaging students in content, whether this is a post-COVID reality or if it's just something that faculty have struggled with for much longer than that. We wanted to help serve you and help give you the tools to re-engage your students in the material that you're teaching. So by giving these resources to you first, you can choose how to disseminate this information to your students, whether it's, you just provide this to them in your content management system, or you provide it kind of granularly as you're going through content, or if you keep it as kind of like an in-classroom exercise, it's entirely up to you. So again, we see PowerPoints here from some of the top books from McGraw-Hill. So these are from McGraw-Hill publications. They're some of our most popular books, and PowerPoints were created with the images, figures, and tables from those books so you can use them and integrate them into however you are lecturing, teaching, providing your students studying materials digitally without having to scan the book and get those really dark, grainy photos that you get from trying to scan something. And then down here, we have instructor resources exclusive from Sigma Theta Tau. So these resources are individually saleable products on Sigma's marketplace, but you are getting them all here for free. So students would have to pay for these individually to interact with them. They are on average $30 each, but you are given them for free. And so then your students have them through you to better interact with the material. I'm sure a lot of you are familiar with the Johns Hopkins evidence-based practice model. This is the book here, one of the more popular books in APN education. And then if you go down here, you can click on the facilitator's guide, and then you are brought to this entire product that helps you to engage your students. It's all content separate from the book. It's high yield, it's really interesting, and it's at your fingertips through your subscription, your institutional subscription to AccessAPN. So with all that said, I'll wrap up with saying that if you have any questions about specific content on the site, or there's something that you would love to see on the site, or even better, there's something you'd love to contribute to the site. If you think that as an educator, as a content creator, as an author, you have something that you want to explore, whether it's a book or something you don't even see here. The benefit to having such a new digital platform is that we have a lot of runway to create new content. Some of the things we're doing here are really fresh and new and not done by our competitors, not done on other sites. And it's been really fun to do. So the sky's the limit, really. And I would love to hear from you if there's something you would like to see or something you'd like to do with us. Thanks so much.
All right, I'm going to jump in and give you guys an overview of AccessMedicine. I'm Julie Grishaw. I'm the editor of AccessMedicine and also a practicing acute care nurse practitioner in the ICU. I'm sorry that I sound like a frog. I don't normally sound like that. I'm getting over an upper respiratory infection and have an asthma exacerbation from that. So I apologize if I cough during this. I probably will. So, I'm not sure what happened to my screen share. Okay. So this is the AccessMedicine homepage. You can see our core book titles here displayed across the homepage. I want to highlight a couple of our book titles, and this is going to be a very rapid fire overview. We could spend the entire hour going over Access Medicine. Our top two medical titles are Harrison's Principles of Internal Medicine and Current Medical Diagnosis and Treatment. I think we hear from most NP programs that they use Current Medical Diagnosis and Treatment for their core medical title. We also hear from some that they use Harrison's. And they're our top two most utilized books on the platform. We also see a lot of schools using symptom to diagnosis, and I wanted to show that off really quickly. My search is going to work. Oh, sorry, my computer's doing weird things. So symptom to diagnosis is our third most utilized resource on the site. And I think this is a particularly important book for acute care NPs who are learning how to build a differential diagnosis from the ground up, especially those family NPs, those emergency room NPs who are seeing people at their first point of encounter. I'm just going to open up one of these chapters to give you a bit of an idea of what it looks like. This is broken up on a symptom-based approach and teaches students how to construct a diagnosis by going through a differential. And it approaches it in a symptom-based fashion. So it'll take a patient with abdominal pain and run you through how to think through that and then achieve a diagnosis. And so this is a really unique resource, and it's really just loved by both medical students and nurse practitioner students. Just going to head back over to the book tab for a second. We also have content both for hospital medicine. We have content for gerontology and content for pediatrics. I wanted to show a couple of those. It's just easier if I do a quick search instead of taking you through all of our books. Okay, so we have Principles and Practices of Hospital Medicine. See, we have Hazards Gerontology. It's a great one as well. And then we also have Tensionelli's Emergency Medicine. So we are often thought of as an ebook library. And we have so much more to offer than just our ebooks. We have so many cases, which I know are so hard to come by for faculty members. We have so many quick reference resources because, you know, NP students, it's been a while since I was an NP student. I graduated in 2010. But I know that NP students are looking for something that they can just pull up when they're getting ready to go in and see a patient. You know, they have that case that they're getting ready to go see and they need a quick refresher. And we have quite a number of resources that they can utilize right before they go in to that clinical experience. And I wanted to show a few of those as well. Some of the favorites, this is one of our most utilized resources that's both for studying and quick reference, our infographic guide to internal medicine. We have over 600 infographics. This is the largest collection of infographics for medicine compared with any of our other competitors. And these have been hugely popular. We're coming out with an infographic collection guide for surgery as well, for the most common surgical procedures. Let me just pull up one of these. Students can also print these, and they have a QR code on them that will take them to a search page about the topic in question. And so these are great. They just give a broad overview of the features, the lab findings, and the treatment. So it gives you a, not only what are you looking for, but how to treat it. So a quick one-pager, if you will. We also have some other really great quick reference resources. We have Hubbard's Notes, which is very much akin to pocket medicine. I remember carrying my red pocket medicine around. It was a different color every year, and my year was red. And so I'll never forget that. And so this, however, has so many more visuals than pocket medicine and has become very popular. And I'm sure, oh, of course, the one I pull up doesn't have visuals in it, but it does statistically have more visuals and more algorithms than pocket medicine. And I can provide you with those numbers. In the interest of time, I'm not going to find all of them on this webinar. We have QMDT, which pairs with our current medical diagnosis and treatment. So this is a bulleted version of current medical diagnosis and treatment that can really be drilled down and distilled when students need a very quick version, and it links to the larger version. So let's take a look at a topic here, and I'll show you a bit about how that works. And please ignore this red here. I have a back-end view so I can do some content linking. So your view will not be disturbed by that. So here your students can jump in if they want that really quick overview of a AAA. Read through the essentials of diagnosis, clinical findings, diagnosis, treatment, etc. But if that's just not enough, they can jump over here to the big book. And so now you're here in the big book. You can say here, I can really read more about those clinical findings. If my patient's a little bit more complicated, I can look at the CT, things like that. We have our drug monographs. These are standard across the Access sites. We have a wealth of multimedia. NPs are doing more and more procedures. We're gaining more autonomy, and procedural videos are really a must-have. Physical exam videos are a must-have. We have hundreds of videos on the site. I wanted to show a few of our physical exam videos. We have a very robust selection of neurology videos, both normal and abnormal videos. Some of them are just very short snippets of the abnormals, and then we have some long videos that students can watch if they want to see an entire normal exam. So, some students don't know how to chart things because they've never seen them, and you don't always see that very abnormal thing, in your clinical setting. So you need to be able to see it once to really know what you're looking for. And so, here, jovial venous pulsations, if they've never seen that, how can they know what to chart? And so there's just a quick snippet of that, for example. And then, here's a little bit longer video, of an exam for skeletal injuries. I wanted to take a quick look at our procedural videos just to show you an idea of what we have. We have the core procedural videos for internal medicine, central line, paracentesis, thoracentesis. And so I'm just going to show you those really quickly. Sorry. Here. And so they're all separated out by part of the body. And so you can look at, for example, chest tube insertion here. And we're constantly adding procedure videos. So we're adding thoracentesis here. And so you can see nerve blocks, etc. One really exciting thing that we have added just a few months ago is POCUS Pearls. This is a new series that focuses on ultrasound basics. And this is excellent for NP students, excellent for medical students. And as a nurse practitioner, I really learned POCUS hands-on at the bedside. There are classes that we are sending our nurse practitioners to that cost them out of pocket. to go to. And this is a nuts and bolts approach to learning POCUS at the bedside. And this is something that you can give to your nurse practitioner students for free. It teaches nurse practitioner students how to use the dials on the ultrasound, how to look at the gain, how to know if you have a good image. These are things that you're just handed the ultrasound and expected to know. You aren't really ever taught that. You know, you're expected to have the ultrasound on a patient and know what the vessel looks like, or have the ultrasound on the abdomen and know if ascites is there, but you're never taught how to get to that point. And this is a series of videos that teaches you how to get to that point, how to know which transducer to use, how to know how to set the gain, how to know if the image you have is quality. And this is huge for nurse practitioner students because all of us are going to be using POCUS in the field in some form or fashion. And nurse practitioner students are really just going to value this hugely. So this is something to point out to them. We have podcasts. These are very appropriate for nurse practitioner students and even practicing nurse practitioners. From Harrison's podcast and Run the List and Symptom Diagnosis, these cover a broad swath of just general medical topics. Okay. Then we have cases. I wanted to point out a couple of our cases in particular. So we have our Vanderbilt Internal Medicine Pediatrics curriculum. In some of these, you may think, well, all of our folks don't do pediatrics. These don't inherently all have pediatrics associated with them. So you can sort of pick or choose if you want to do pediatrics. This is our most popular case content collection on the site. These are excellent. They are updated constantly. We have 15 case updates per year and add 5 new cases per year at least. This covers, again, a broad swath of internal medicine. Pediatrics cases are included, but not every case is pediatrics. So it's appropriate for family and acute care NPs. We do also have some psychiatric cases in here. We have rapid recall questions associated with this and flashcards associated with this. I wanted to point out our Critical Concept Mastery series. This is a set of very high-level cases, very appropriate for nurse practitioners. This case series was developed by an attending at Duke for double and triple acid-base disturbances. We couldn't find any competitors on the market that even came close to this. This is really great for acute care nurse practitioners. It's probably not for family nurse practitioners, but for those acute care NPs, they really need to know how to decipher double and triple acid-base disturbances. We also have the chest imaging cases. These are real life chest x-rays, chest CTs, walking you through the cases on how to interpret those. Great for all nurse practitioners. And again, there is really not much like this on the market, and would be very difficult and very time consuming to create cases like these. And we have these over 50 cases here on the site ready to go, ready for you to use. We have Graber and Wilbur's Family Medicine Board Review. And when you see this, you might think, well, that's board review. That's not appropriate for a nurse practitioner. These are family medicine cases. They are great. They are very appropriate for your family medicine nurse practitioners. And some of them, you know, I think, look at them. I think they're appropriate for acute care NPs as well. They're not acute care NP board review, but they're very, very appropriate for acute care NP study material. Let's take a look at our study tools. Show you our flashcards really quickly. And then I'm gonna wrap up because I could talk forever. So we have flashcards, Vanderbilt Rapid Recall flashcards. Galen's diagnostic exam flashcards. Those are probably the two most appropriate for NPs. Review questions. These are quiz questions associated with the books. Much like Sydney talked about, they're split up into basic science and clinical practice and board review. You'll probably want to go to clinical practice and board review, which is more appropriate for our NP population. Again, these are associated with books. And then you have our hospital corner tab. This is the same content, but it sort of filters out medical student content and is for practicing providers. So this would be more for practicing nurse practitioners. Then we have our for instructors tab, and this is the same thing that Sydney pointed out. It's for faculty. And it's the content that is for instructors only. So it's just what Sydney showed you. And in the interest of time, I'm going to hand things over to Melanie. I'm sure I've left things uncovered, but please feel free to reach out to Kaylin and she can put you in contact with me.
Thank you so much, Julie. Thank you, Sydney. That was a great overview. Now I'm going to share my screen. So I'm Melanie Allison, and a couple of years ago, the American Association of Colleges of Nursing came out with their competency-based essentials. And when those came out, they were much longer, obviously, than the other versions that they had previously that were not necessarily competency-based. So when we got those, I mapped the content from our two great sites, AccessAPN and AccessMedicine, to each of those domains, and then each of the subtopics beneath those domains. And I believe that our wonderful hostess, Kaylin, is going to share a link in the chat. So you guys can see a link to this content map. And you can see it is 107 pages long. So this covers every single subtopic within each domain. So this is very important, obviously, for accreditation purposes, to show that you have trustworthy content that you're sharing with your students, that you're recommending to your students. If anyone wants to see any particular topic, just let me know. Let's make this a little bit more interactive, so I'm not just talking with you. Sydney and Julie did a great job of showing an overview of everything we have on the sites. But if there's a particular resource that you're looking for, or a particular case type, subject matter, let us know and we can pull that up and show it to you.
Thank you, Melanie. While everyone out there brainstorms a topic they want to pick Melanie's brain about, if you're watching the recording right now, there should be a link in the email you got with a link to this content map. Otherwise, if you are looking for these content maps, because we don't only have them for, we don't only have this content map, we have many. All of which a lot of dedicated care and expertise have been put into. So if you are on any of the sites and you click into training and support, that will take you to the Access User Center, where you can find many resources on how to navigate the various medical products you subscribe to. Sorry that it's displaying weird on my screen. I have two screens open right now. There we go. And if you go over here on the left-hand side and click Content Map, you'll actually see all the different available content maps for all of our Access Medical sites. And luckily with this one, it's just right at the top. So did anyone have a topic or a specialty area that they want to pick Melanie's brain about? You can just put that in the chat. If not, Melanie, I trust your expertise to take us somewhere great.
Hey. Well, let me stop sharing my screen and then I will see if I can show you something here, maybe on AccessMedicine.
Great.
Okay. So as Julie said earlier, CMDT is our most popular resource there with the NP programs. And probably a lot of you are very familiar with it, but it comes out every September. So we have a new edition that just surfaced. And then the cases, as she said, are really fantastic. We have the Vanderbilt cases are wonderful. The acid-base disturbances cases are excellent. I know as an acute care nurse practitioner student, I struggled to understand acid-base imbalances, and I would have really benefited from having cases like that. It really helps to demystify that complexity of that topic. We have excellent multimedia. So pathophysiology, some of the pathophysiology concepts can be a little bit difficult to understand, and we have these animations, which I think are really good. And I'm not going to totally play it for you, but you can see the graphics are very good, and then you have a transcript with it, which is helpful depending on your learning style. And then if you just need to look up something very quickly, I think Julie mentioned this before in her tour as well. We have QMDT. I can get it to pull up for me. Which I always enjoyed looking up. So if you're just talking about a topic, or you know you're going to see a patient with a certain diagnosis and you can't quite remember all the details about it, how to diagnose, how to treat, you can just look it up here very quickly. And it will give you just a brief overview. So you have the key features and everything's bulleted, so it's really nice. You don't have to read an entire book. And then if you want to go down and just focus on the treatment, you can see there quickly the treatments. And then I can go over to AccessAPN. So that Johns Hopkins book, that's the one that I used for my DNP program, and it was really fantastic. Sorry, it's displaying a little strangely on my screen. Does anyone have any questions? Anything that anyone has requested to see?
As a reminder, if you have questions, they are very welcome in the chat or in the Q&A. You've got the experts right in front of you, and I'm the librarian, so I'll say it. There are no dumb questions. So anything you have, please ask. While you think of some questions, there's one thing I'm going to show you, which is just, let me share my screen here. If you don't already know, in addition to launching AccessAPN a little over a year ago, we even more recently launched a brand new app. Hopefully you can see my screen. We can see AccessMedicine again, maybe not. Okay, great. So we just launched an app, And this app is going to, if you're familiar with the old app, it was great. It included a couple of our quick reference tools. But now the new app includes all Access Medicine content, or at least the vast majority. It might not quite have some of the study tools yet. It also includes Access APN content. So just another great thing. Another thing to explore as you're kind of digging into what's out there is the Access by McGraw-Hill app and the Access Medicine and AccessAPN content that comes with it if you're a subscriber. So just want to throw that out there that everyone knows. Any other questions in our last couple of minutes here?
And just to add about the app, very recently, it was launched and is compatible with iPads as well. So in addition to being great for the iPhone, it is completely compatible with your iPad. I know that a lot of us rely on iPads, especially students and faculty, especially students, as a great study tool, a little bit more on the go, but not as tiny as an iPhone. So the app is averaging something like 5,000 downloads a week since its launch. So it's been a really successful launch. It's a very smooth user experience and can be used kind of on any of your devices.
Thank you, Sydney. It's available on both your iOS Apple devices and Android. And then I know we had quite a few librarians on the call. So I will say too that if you're trying to promote that app at all, if you go again to that training and support page, and then you find over on the left-hand side under medical products, this is just good for everyone to know too, because under the left-hand side, under medical products, you'll see a whole category of information about AccessAPN. You'll see a whole category of information about Access Medicine. And then we have information too about the app. So here, all of this content is available for all of these different sites. So we have a LibGuide for the 2 sites we just went over. We have a LibGuide for the app. And then we have flyers, FAQs, some short videos on using those resources. And then, of course, if you scroll down even further, we have those content maps as well. The last thing we have on those sites that I want to make sure you know about is our contact information. I know it can be hard, especially at the end of the day, to come up with questions during a live webinar. But if you do have questions at any point, or you're like, oh gosh, Melanie mentioned that really great resource and I can't remember the name of it, or like, what was it that Julie or Sydney were saying about? You can email my team anytime, and I'll be sure to get you in touch with the appropriate resource. And I'm with the customer success team. You can just say, hey, customer success, I had a question about that webinar, and we'll figure it out. But this is our email, customersuccess@nheducation.com. So if you have any questions after the webinar today, that is the email for you. Similarly, if you want instructor resources added to your Access profile, please send an email to that account and we will get those turned on for you. You won't even have to go through the regular verification process because I will know that you attended this webinar as a faculty member. So that'll be great. Any questions in our last minute here?
One last plug. If you are a part of an institution that subscribes to Access Medicine, but not yet Access APN, or perhaps you're part of an institution that subscribes to neither, and you are interested in learning more about what a subscription would look like for your institution, or you want someone to reach out to the decision maker who maybe handles the purse strings, you can also email that customer success email address and someone will put you in touch with the regional person for your institution. You can get a more in-depth demo and you can get a lot of information about what a subscription could look like for your institution. These institutional subscriptions are fantastic because they are paid for by the institution, and then every faculty and student is given free access to everything. Nothing is behind a paywall once you have institutional access. So it's bringing a lot of kind of equity to education. Textbooks are supremely expensive and only climbing in costs. And this puts everything in the hands of you and your students free of charge to you all.
right. Thank you so much, Sydney. Thank you, Julie. Thank you, Melanie. And thank you, most importantly, to everyone who shared their time with us today. We look forward to hearing from you, and we hope you learned something new today. All right. Thank
Bye.
you.
Thank you.
Thanks, everyone.
Bye.